7 common medications that can damage your kidneys. In today's world, medications are a double-edged sword. While they can help, they also carry risks, especially for our kidneys as we age. Our kidneys naturally become less efficient over time, making it crucial to avoid overloading them with chemicals and medications. Unfortunately, aging often comes with more health problems and more pills. Certain medications can harm the kidneys, known as nephrotoxicity. This damage can decrease the kidney's ability to filter blood, leading to serious health issues. Kidney damage ranges from mild to severe, with the risk increasing with age and pre-existing kidney conditions. There are 2 main types of medication-related kidney damage: dose-dependent and idiosyncratic. Dose-dependent toxicity means the damage increases with higher doses of the drug. Idiosyncratic toxicity is unpredictable and varies between individuals. Sometimes, avoiding these drugs is the safest option. Drug-induced nephrotoxicity can result from muscle breakdown, rhabdomyolysis, kidney tissue death, renal infarction, and acid buildup, renal tubular acidosis. These issues can lead to reduced kidney function, nephrotic syndrome, or electrolyte imbalances. In this video, we'll discuss how common medications affect kidney health and offer tips for safely managing these drugs. Understanding these risks can help you make informed healthcare decisions. Stay tuned to learn how to protect your kidneys while treating other health conditions. Before we begin, note that all information in this video is human-produced, thoroughly fact-checked, and reviewed by professionals. Let's look at the medications that can harm your kidneys. 7. Antibiotics. Antibiotics are commonly prescribed, but they come with risks, especially for your kidneys. If your doctor gives you antibiotics for a sore throat, skin infection, or other infections, it might harm your kidneys. First, let's understand what antibiotics are, also called antibacterials or antimicrobials. These medications fight bacterial infections by either killing bacteria or stopping them from growing. Common antibiotics include brand names like Cipro, Augmentin, Flagyl, Bactrim, and amoxicillin. They're used to treat bacterial infections like strep throat, pneumonia, urinary tract infections, otitis, and skin infections. However, antibiotics don't work against viral infections such as colds, flu, bronchitis, most coughs, and most sore throats. So, it's crucial to be cautious when your doctor prescribes antibiotics. Improper use of antibiotics can cause side effects, including diarrhea and liver and kidney problems. Even when used correctly, some antibiotics like polymyxins, aminoglycosides, and vancomycin can still harm your kidneys. Your kidneys play a vital role in removing antibiotics and other drugs from your body, but antibiotics like polymyxins can damage kidney cell membranes, leading to injury. Similarly, aminoglycosides can build up in kidney cells, causing cell death and damaging kidney tubules. While the exact way each antibiotic causes kidney injury isn't fully understood, it often involves inflammation and harm to kidney cells. For antibiotics to be effective and safe for your kidneys, it's essential to use them correctly. Did you know nearly 1/3 of antibiotics prescribed in the U.S. aren't appropriate for the conditions being treated? This comes from the Centers for Disease Control and Prevention, CDC, and a study published in the Journal of the American Medical Association. Before asking for antibiotics or if your doctor prescribes one, it's important to know which conditions they can treat. Ask your doctor, is this necessary? Most doctors will gladly explain why it's needed. If antibiotics are truly needed, follow the dosage instructions carefully and stick to any food requirements. Even if you feel better, never save antibiotics for future use or give your prescribed antibiotics to someone else, as prescriptions are tailored to individual health needs and conditions. Enjoying our video? Please drop a like and we'll create more content like this. 6. Non-steroidal anti-inflammatory drugs. Many people may not recognize non-steroidal anti-inflammatory drugs, NSAIDs, by name, but you've likely heard of ibuprofen, aspirin, Motrin, ketorolac, celecoxib, or naproxen. These are all NSAIDs and some can be bought without a prescription. In fact, over 30 million people take NSAIDs daily. They're commonly used to relieve headaches, sprains, colds, flu, and arthritis pain. NSAIDs work by blocking an enzyme called cyclooxygenase, COX, which helps produce substances that cause pain. However, COX also protects the kidneys during stress and helps regulate sodium and water excretion. By blocking COX, NSAIDs can harm your kidneys. All NSAIDs can cause acute kidney injury, AKI, especially in older people, and when taken in high doses or for long periods. This injury happens in two main ways: changes in blood flow and inflammation, both due to blocking COX. First, blocking COX can narrow kidney blood vessels, reducing blood flow. This can lead to fluid retention, high blood pressure, and temporary kidney impairment. If unchecked, it might cause severe issues like acute tubular necrosis, where kidney tubules die due to lack of oxygen, leading to acute kidney failure. Although it might look like acute kidney failure at first, it can progress to chronic kidney disease. Second, although NSAIDs are anti-inflammatory, prolonged use can trigger inflammation in kidney tubules, which filter waste. This inflammation is rare, but kidney issues from NSAIDs are a major concern, affecting 1%–5% of daily users worldwide. This means that each year, around 500,000 to 2.5 million people experience kidney injury from NSAIDs. Worse, NSAIDs are often involved in hospital admissions due to adverse drug events, some of which can be deadly. A 2006 study in the Journal of the American Society of Nephrology analyzed data from over 10,184 people prescribed NSAIDs. The study showed that NSAID use raised the risk of acute kidney injury by 26%, especially within the first 30 days of use, highlighting the need for caution with these medications. In another study, scientists looked at 99 patients with chronic musculoskeletal pain who took NSAIDs for 12 months. They found that most patients' kidney function decreased after NSAID use but returned to normal after switching to another pain reliever. For those interested in the evidence, the studies supporting our claims are provided in the link in our description box. Now, the next set of drugs on our list might surprise you because they're typically considered good for your kidneys. 5. Diuretics. Diuretics help with conditions like fluid retention or swelling, often seen in heart and kidney failure and liver cirrhosis. Some diuretics are available over the counter, but prescription diuretics are typically stronger. Common ones include hydrochlorothiazide, HCTZ, bumetanide, Bumex, furosemide, Lasix, spironolactone, aldactone, and acetazolamide, Diamox. They work by increasing urine output and expelling excess salt and water, which can help lower high blood pressure, a major risk factor for kidney disease. Thus, diuretics are generally suitable for your kidneys. However, while diuretics are beneficial overall, they do come with risks, especially for kidney health. They don't directly damage the kidneys like NSAIDs, but they affect the urine's concentration and composition by increasing its volume and changing electrolyte levels. Excessive use or high doses of diuretics can lead to dehydration, which is a risk factor for kidney damage. A study examined 131 patients using diuretics who had acute kidney injury between 1999 and 2010 at a hospital. Initially, 96.2% of these patients already had at least one health issue before starting diuretics, with chronic kidney disease, CKD, being the most common at 55%. The study found that patients on diuretics had higher rates of kidney disease and its risk factors like hypertension and diabetes. The higher the dose, the greater the risk. About 27.5% of the acute kidney injury cases were caused by diuretics alone, while others resulted from a combination of diuretics and other drugs. Always consult your doctor before starting new medications with diuretics. For people with CKD taking diuretics, it's important to stay hydrated and regularly check electrolytes and kidney function. Nowadays, home testing options are more available, so you can check your kidney function from home. 4. Proton pump inhibitors, PPIs. Proton pump inhibitors, PPIs, are widely used medications available over the counter. They effectively treat conditions like gastroesophageal reflux disease, GERD, or acid reflux by reducing stomach acid production. PPIs target an enzyme in the stomach called hydrogen ATPase or proton pump, which is crucial for acid secretion. While PPIs are generally safe and effective at soothing acid-related discomfort, like heartburn, they carry risks, especially for kidney health. PPIs have been linked to acute interstitial nephritis, AIN, a kidney disorder characterized by inflammation in the spaces between the kidney tubules. Although only a small number of PPI users develop AIN, PPIs have become a common cause of drug-induced AIN in developed countries. AIN caused by PPIs often shows no clear signs and can go unnoticed. Long-term PPI use may lead to lower kidney function and sudden acute kidney injury, which can progress to chronic kidney disease (CKD). Another side effect of long-term PPI use is low magnesium levels in the blood, hypomagnesemia, which is linked to CKD. Hypomagnesemia can disrupt your electrolyte balance and cause inflammation, leading to kidney disease. It can also cause other serious health problems, including muscle spasms, seizures, and irregular heartbeats. A 2019 study in the Journal of Pharmacotherapy investigated the effects of PPIs on kidney function. The study examined how PPI use relates to new cases of acute kidney injury, AKI, and chronic kidney disease, CKD, in a large group of people. They found that among 93,335 people, those taking PPIs had a 4.35 times higher risk of AKI compared to non-users. Similarly, among 84,600 people, PPI users had a 1.2 times higher risk of CKD compared to non-users. Therefore, people taking PPIs should have regular checkups to monitor their kidney function and magnesium levels. While PPIs can provide significant relief from acid-related issues, long-term use can harm your kidneys and cause other problems like infections, fractures, or nutritional deficiencies. It's important to take PPIs for the shortest time possible to relieve acid-related issues without increasing the risk of side effects. 3. ACE inhibitors. Angiotensin-converting ACE inhibitors are prescription medicines commonly used to lower blood pressure and manage heart, blood vessel, and kidney conditions. Common ACE inhibitors include lisinopril, Zestril, Pradivil, Ramipril, Altis, Enalapril, Bisotek, and benazepril, Lotensin. These drugs work by blocking an enzyme that produces angiotensin II, which narrows blood vessels and increases blood pressure. By blocking this enzyme, ACE inhibitors help relax blood vessels, lowering blood pressure and reducing stress on the heart. ACE inhibitors also improve blood flow to the kidneys, easing their workload and providing long-term protection. They can reduce the presence of protein in the urine, a common issue in chronic kidney conditions, making them a recommended treatment for people with kidney disease. While ACE inhibitors have protective benefits, they come with risks. Combining them with NSAIDs and diuretics can increase the risk of acute kidney injury, AKI. Additionally, not drinking enough water while taking ACE inhibitors can put you at more risk of AKI. If you're worried about your risk of AKI with these drugs, it's best to talk to your doctor about ways to lower it. Some people worry that ACE inhibitors might decrease their estimated glomerular filtration rate, eGFR, which typically indicates kidney function. However, ACE inhibitors lower eGFR by reducing pressure on the kidneys, allowing the small filters, glomeruli, to relax. While this may cause a slight decline in eGFR, it doesn't indicate kidney trouble. It means the kidneys are relaxing. However, sometimes eGFR may drop too much, especially in patients with heart failure, chronic kidney disease, or blockage in both renal arteries. If this happens, your doctor may adjust your dosage or temporarily stop the medicine to find the cause. In rare cases, particularly in patients with heart failure or severe dehydration, ACE inhibitors can cause acute renal failure. However, most patients recover without lasting kidney damage once they stop the medication, even if dialysis is needed initially. Patients with heart failure, diabetes, or chronic kidney disease benefit from ACE inhibitors because they reduce kidney strain and offer long-term protection. However, dosages should be carefully adjusted and kidney function should be regularly checked. 2. Antiviral drugs. Most viruses clear up without antiviral drugs, but doctors prescribe them for serious or long-lasting diseases like COVID-19, Ebola, flu, genital herpes, hepatitis B and C, and HIV. These drugs can help clear the flu and fight other viruses. For flu, common antiviral drugs include oseltamivir, Tamiflu, and zanamivir, Relenza. For chronic infections like HIV, hepatitis, and herpes, antivirals can't completely cure them, but can ease symptoms and reduce severity. While antiviral drugs are beneficial, they can harm the kidneys. This risk comes from direct toxicity or crystal buildup, which can cause kidney stones. Careful management and customized treatments are essential, especially for those with existing kidney problems. Take remdesivir, for example, a drug used in COVID-19 cases. Remdesivir contains SBCD, which the kidneys mainly remove. In people with kidney issues, SBCD might build up and cause kidney toxicity. Some clinical trials have inconsistently reported decreased kidney function with remdesivir. Data from global databases showed a significant increase in acute kidney failure cases associated with remdesivir compared to other COVID-19 drugs. However, more large-scale studies are needed to confirm its safety for people with kidney issues. Other antiviral drugs like cidofovir, adfovir, foscarnet, acyclovir, interferon, and tenofovir can directly cause cell death in kidney tubules by reducing blood flow or increasing toxins, leading to acute tubular necrosis. Atazanavir can cause inflammation in the kidney's interstitial tissue, impairing function. Acyclovir, indinavir, and foscarnet can cause crystal buildup in the kidneys, blocking tubules. Some drugs like Vired and foscarnet can manage kidney damage but also pose a risk of kidney failure. To use antiviral drugs safely, take them under close medical supervision. Never skip doses or take them inconsistently, as this can lead to antiviral resistance, making the drugs less effective. Remember, antiviral drugs are only available with a prescription, so don't buy them online or from unofficial sources. 1. Lithium. Lithium is a prescription medication used to stabilize mood and treat certain mental illnesses like mania and bipolar disorder, which cause extreme mood swings. Some common brand names of lithium are Priadel, Cancolit, Liscanum, and Liquid. For over 60 years, lithium has helped many people manage bipolar disorder. While lithium is essential for controlling mood, it can negatively affect the kidneys. Long-term use can lead to serious kidney problems, including acute and chronic kidney disease and kidney cysts. Initially, kidney damage from lithium might be reversible, but it can become permanent over time. A major issue with lithium use is a type of diabetes linked to kidney damage called nephrogenic diabetes insipidus, which isn't related to high blood sugar. In this condition, the kidneys can't respond properly to a hormone that controls fluid balance, leading to excessive thirst and frequent urination. In rare cases, long-term lithium use can lead to end-stage renal disease, ESRD. Symptoms of kidney trouble from lithium include excessive urine output, constant thirst, frequent nighttime urination, and signs of dehydration like low blood pressure and a fast heartbeat. In severe cases, it can also affect mental status. Additionally, lithium can cause the kidneys to excrete too much sodium, leading to a condition called hyponatremia. If sodium levels drop suddenly, it can cause serious problems like muscle breakdown, severe confusion, seizures, coma, and even death. Patients should maintain a regular diet with enough salt and fluids while taking lithium. It's important to define a suitable dosage, get yearly blood tests to check creatinine levels, and seek medical help if anything seems wrong. Before starting lithium, let your doctor know if you have kidney, heart, thyroid, or breathing problems, Addison's disease, or Brugada syndrome. Extra tips for safe use. If you think your medication is affecting your kidney health, seek medical advice right away. Early symptoms of kidney failure might not be noticeable, but as it worsens, you may experience decreased urine output, leg swelling, shortness of breath, and severe fatigue. If untreated, these can become life-threatening. Remember these symptoms so you know when to act. If you are taking any of the medications mentioned, regularly check your kidney function with blood tests for creatinine levels, glomerular filtration rate, GFR, and urine tests for protein. Staying properly hydrated helps your kidneys clear sodium, urea, and toxins, reducing the impact of harmful drugs. Be aware of potential interactions between your medications that could affect your kidneys. Share all your current medications with any healthcare provider who prescribes a new drug. While medications are essential for treating various conditions, some pose significant risks to kidney health and should be used cautiously, especially in individuals with existing kidney disease or those at risk. Antibiotics, NSAIDs, diuretics, proton pump inhibitors, ACE inhibitors, antiviral drugs, and lithium can impair kidney function through various mechanisms, such as direct toxicity, affecting blood flow and causing electrolyte imbalances. For those with kidney disease, it is crucial to avoid or carefully manage these medications. Work closely with healthcare providers to choose treatments that minimize risk to the kidneys, adjust dosages as necessary, and monitor kidney function regularly. A healthy lifestyle can help minimize medication use. Eat a balanced diet with lean protein, fruits, and vegetables, and exercise regularly to protect your kidneys. For more on kidney health, subscribe and hit the bell icon for notifications.